So hi everyone, we're actually from Linn-Benton Volunteers, which is the nonprofit organization for RSVP and Hands on Linn-Benton, and that's why we're here today. I'm going to talk to you about the SHEBA program. It's good to see a few people in this room that have already learned a little bit about the SHEBA program and know what we do in the community. SHEBA stands for Senior Health Insurance Benefits Assistance. We help people who are Medicare eligible or maybe have family members that are concerned in helping their parents, grandparents who have Medicare questions and issues. And what we do is right now we have 12 volunteers that are fully trained in all issues of Medicare. And they meet with people in 3 different locations in Benton County. We just added Monroe and Philomath in the last year. They also meet with people at the Corvallis Senior Center 2 days a week. And I don't know how many of you, it doesn't look like too many in the room, could potentially be on Medicare, but it's very, very complicated. When you first turn 65, you get a stack of information like this to try and figure out. As you move through Medicare, Medicare Part D is the prescription drug plan. It's a good idea to check it every year because the formulary changes every year. And your prescription may not be included with that drug plan in the next year that is included in the current year. So to find that information, typically people need to go online. And how many people do you know in their 80s and 90s that are effectively using computers to find that information? So these volunteers are doing a huge service in the community. Last year they helped over 300 people individually, one-on-one. It's typically an hour, hour and a half counseling time that they meet with them. And in addition, they had workshops on nearly an every month basis, but we do the Medicare ABCD and the new to Medicare workshops every other month, and we will see anywhere from 20 to 75 people coming to those various workshops. We are hearing the stories about how we have saved people a tremendous amount of money, but more than anything, what really feels great to us is the fact that we are helping people that are in their most vulnerable stage in life in many cases. I have a couple of stories that came from our Benton County volunteers. One of them was about a father-in-law who actually had a stroke when the kids, the couple, were in the plane on the way to Atlanta. And somehow or another, maybe when they landed, I guess, they got a hold of somebody back here and the SHEBA volunteers went to work. Because what was unfortunate for him was his insurance had canceled December 31st and he had not renewed an insurance, and 10 days later is when he had a stroke. So the volunteers went to bat, and after a lot of calls back and forth, they worked with the Center for Medicare and Medicaid Services. They actually got it covered. They got him back into a plan. It was just one of those things where these volunteers will make every call, they will push every button, they will do everything they can to make sure that these people have coverage. Another situation was a 29-year-old disabled person. If people are disabled, they can qualify for Medicare. A lot of people don't realize this. He had a cochlear implant, he didn't have good hearing, he had a very thick accent, and so it made it hard for him to hear, but also to communicate. And he was denied coverage, and he didn't know how to fight for himself. And again, the SHEBA volunteers went to bat. So it's not just helping people decide on plans, it's not just helping them find the insurance plan that's best for them. They really do advocacy work. They do Medicare fraud work. We just had a call this week that somebody has resolved on durable medical equipment, where there tends to be a number of Medicare frauds in that area. And this person was billed for a hearing aid repair that they had already been prior authorized for, or told they were prior authorized for, and they were billed for the full amount. And so the SHEBA volunteers are reporting that to the Fraud Patrol, they're reporting it to the Insurance Commission, and they're just the most amazing group. All we're asking for is $5,000 to keep this program active and alive in Benton County. We also work with signing up low-income subsidy people. So it's a phenomenal program. And now I want Sarah to take some time and tell you about Hands on Linn-Benton and the Volunteer Center.
Okay, good evening. So as she said, I'm with Hands on Linn-Benton. We just recently changed our name. We were previously LB Vision Volunteer Center. And we are a separate program from RSVP. I know sometimes there's some confusion, but we do entirely separate work. And even though we do partner closely with RSVP, We are a local affiliate of the national network, Hands On. I'm not sure if you're familiar with them. They merged with the Points of Light Institute several years back. So what we do in our community is we are the volunteer center that we help with coordinate and recruit management. Wow. Oh my goodness, I haven't been there since college. Excuse me. We are the coordinated recruitment and management for volunteers, which this community desperately needs. What we're seeing is a little bit of duplicated efforts. We have the OSU Community Services Center, and they're coming to us to try to work with us, and we have other volunteer calendars, and we're really stepping up our game, and we're coming to these other partners, and we're saying we need to work together and make sure that we're not duplicating our efforts here. So we are supposed to be the one-stop shop for that, and that's what we're actively doing. So this month is pretty exciting. We were just able to launch the Hands On Connect software, which was designed by the Hands On Network to specifically coordinate and manage volunteer efforts. And so that's what we brought into the community, and that's what we're sharing with our nonprofit partners. So if you see your handout, we do have 80 community partners here in Benton County alone, and those are nonprofit, and some of those are
The Old Hill Center, where we are.
yeah, and so at least 10 of those have received funding from the city. And so the most exciting thing I think about what we do is that the value of a volunteer hour is $20.85. And through our services, we're able to provide that for only $5.11 an hour. So that's pretty neat. So when we are given money to do our services, we're effectively stretching those dollars. So it is neat to support emergency services, to give $5,000 to somebody who's handing out food boxes. But if you give us $5,000, we're able to take that and multiply it into the community. We're able to provide volunteer services for those programs and supplement their staff and supplement their capacity. So the project that we're working on, that we're asking for the funding, is just to make this happen. Currently, our limitations are staff. I'm running the program, and I'm only 16 hours a week. So there's only so much you can do with that. So we're hoping to be able to get some funding just to increase staff time. It'll be spent on mileage and overhead and printing, just everything we need to do to be able to provide these services to our partners. The likelihood of success is very high. We're currently doing this. As I said, we've already launched the program. We're already out there. I've been meeting with community partners. I met with Boys and Girls Club, and they said, oh my goodness, we need this. We were about to go do this ourselves. We were about to invest in this. I'm speaking with other community partners who have said the exact same thing to me. We were about to do this. We need this, and we're able to provide that at no charge. And so it's just really neat to just be out there and providing this and coordinating and just reducing the duplicacy of the efforts there.
So,
Any questions?
love to take your questions about our programs.
I just wasn't completely tracking on, I'm sorry, Woman in Blue.
Sarah.
Sarah. Can you give an example of how Boys and Girls Club would use your services? And what
Oh, I'm
they
sorry. Yeah,
invest in,
I should have explained that more clearly. So, like I mentioned, the Hands On Connect software that was designed for volunteer recruitment efforts. The people like the Boys and Girls Club and the other nonprofit partners I mentioned, they're needing a volunteer management system, and that's what somebody said. I need to be able to track demographics. I need to be able to track volunteer hours. I need to be able to track who signed up for what, and what we're launching. The program we're instigating can do all of that for them, and that's what we're offering to them free of charge. And so what they're looking for, so a volunteer manager at a nonprofit organization who doesn't have much time and they're struggling, to be able to do their whole job in the amount of time they have, they need a system. It's technological support.
So is it a tool or a service then?
It's a software.
Oh,
So it's
okay.
online. It's an online software.
Okay.
And it's something they can log into and track, and it creates reports. And it's just, and like I said, it was customized specifically for the volunteer segment of the industry.
But we also do volunteer management, volunteer leadership classes. We're offering a class this summer in service learning, so that's one of the other components that we're building up in the Hands-On, is a service learning program, which Corvallis School District is working with us on that. They've come to us and asked us to work with them. They want the nonprofits to understand what service learning is about. So there are so many facets of this. 5 minutes does not do it justice. But it is an amazing, amazing tool, and the tool will help us do all these other hands-on programs. That's why it's called hands-on, I think.
That's fine. Okay, so that's our 10 minutes. As we go through, once again, the pace tonight will be brisk. As we go through the evening,